Welcome, Dr. Lamoreux.
Hi, thanks for having me.
Yeah, so we're talking about PMS and insomnia. Again, something that we as naturopaths see, almost on the daily. It's so prevalent. So let's dive in. So talk to me about the menstrual cycle and why women, experience insomnia at some point along the way.
Yeah, so each menstrual cycle is essentially your body preparing for a possible pregnancy.
Right.
And so ovulation, an egg gets released that could get pregnant. If it doesn't, if it does get pregnant, then what happens is your body kicks into overdrive and starts making a lot of estrogen and progesterone, which are sex hormones, to
Hmm.
support the pregnancy.
Yes.
If your body doesn't get pregnant, then those levels drop, and that's where we can see changes in mood and negatively affecting sleep
Hmm.
because progesterone is a hormone that is needed for supporting sleep, and it also involves supporting something in our body called GABA. And GABA is a neurotransmitter that also is involved in sleep and kind of calm, relaxed states.
Right. So if that's dropping too precipitously or it wasn't high enough to begin with, we're going to see that affecting sleep and yanking GABA around and so many things play into that as well as far as cofactors and so on and so forth. So when you have a patient, like where do you start? There's so many pieces that could be at play. Like where do we begin with this?
Yeah, so we want to do a comprehensive assessment, kind of get an idea. So I mentioned that these hormone levels are dropping,
Right.
and that's expected and that's supposed to happen. What we don't want to see is it happening like kind of too much.
Yeah.
And so we want to get an idea of what's happening with your hormones. So we have some different testing that we make use of.
Hmm.
We use blood tests, we use a Dutch test. That gives us a really good view of what's happening with your hormones
Hmm.
in that point in your cycle.
Yeah.
And then from there, we want to make sure that we are kind of balancing everything we can. We want your blood sugar to be balanced. We want your
Hmm.
cortisol levels to be balanced. We want to make sure that there's nothing wonky going on with your thyroid. And then we want to make sure that you have the nutrient levels
Hmm.
required to support those healthy shifts in hormones. So where your progesterone's not dropping too low.
Right, right. So everybody looks different. I mean, that's what I found in treating this. It's like we have this wide net that we cast, and what comes back is going to be different for everybody. So some people nutrients, some people herbs, some people. I mean, you do HRT, which is super helpful. But what would you say is in your arsenal? Like, what are the go-tos as far as naturopathic treatment of this?
Yeah, there's a long list, and
Yeah,
again, everyone's different. We got to kind of figure out what it is that's the most helpful
yeah.
for a lot of my patients. I mean, some of the big ones that I use are B6, magnesium, Vitex. Vitex is an herb that sort of helps kind of a pro-progesterone effect on the body.
Mm-hmm. Yep, that's super helpful. Sometimes adrenal support, right? If
Yes,
if
yes.
it's indicated, we talk a little bit about, those adrenals impacting progesterone production, right? And so that not, but not with everybody. I mean,
And
yeah,
and that's the nice thing about the Dutch test. The Dutch test
yeah,
actually includes that. It looks at sex hormones, but it also looks at our adrenals and the signaling between our brain and our adrenals,
yeah,
and gives us an idea if that's something that needs to be targeted to then support sleep, to support
yeah.
progesterone.
Yeah.
Yeah.
Yeah, and all the rest. And one of the great things I love about the way that we practice, which is spending a lot of time with patients, right? We have the luxury of these visits and understanding over a course of an hour, like how are they sleeping? What is their lifestyle like? What are you eating? Are you running to the subway eating your breakfast, right? Like how do we match, what you're telling us with what the labs say so we can really dial in, and make all these lifestyle changes also support the treatment that we're doing, which is kind of amazing that you bring those two together.
Absolutely. And I think that spending more time with our patients, getting more comprehensive really gives us the best chance to be more targeted in what we're recommending, and get the best results.
Yeah, and that people can resolve from this. One last question for you. Um, what population is a good candidate for HRT in these circumstances? I know I'm getting questions from a lot of younger women wondering about this, but it really is like a very specific population that we use HRT with, right?
Some in certain circumstances, it may make sense for younger women, but ideally, we kind of try to support the body to kind of do its own processes with
Yes.
nutrients
Right.
and botanicals and things. As women get into like a perimenopause, menopausal age, then it starts making a lot more sense
Yeah.
to make use of bioidentical hormones
Mm.
and use that more frequently. Yeah.
Yeah, yeah. So it's exciting. I mean, there's a lot of options here. Women don't have to suffer sleepless nights,
And that's what I love the most about it. It works.
Yeah,
So now
exactly.
we get yeah, patients feel
Yeah.
better.
Yeah.
So if you're perimenopausal, menopausal, you're struggling with sleep and you
Mm.
haven't looked into this, I highly recommend it because it
Yeah.
helps quite a bit.
Yeah. Come see us. We have solutions. So thanks. This is super helpful. I
Yeah.
appreciate it.